you think your blood pressure is normal or even borderline? Well, it's time to think again.
With 1 in 4 Indians affected with hypertension or high blood pressure, this very well can be deemed as an epidemic. If hypertension is not properly treated, it can lead to a lot of complications like stroke, heart disease, kidney problems, and even eye problems.
Exactly. And that is why on this very show, we have talked about the importance of treating hypertension and what is some of the newer research and evidence that has come out in this field. Keeping all these studies and newer research in mind, the international guidelines have come out just last week where the actual definition of hypertension has been changed. It has also been recommended to be a lot more aggressive in treating hypertension.
So today, let's try and decode some of this information for you. I'm Dr. Sonalal Gupta.
And I'm Dr. Sameer Gupta. And welcome to Doctors on Call. With 1 in 4 people in India diagnosed with hypertension or high blood pressure, this has reached epidemic proportions. If left untreated, high blood pressure, also called hypertension, is also responsible for 50% of the strokes and 25% of all heart diseases. After 14 years, the international societies have updated recommendations for the diagnosis and treatment of high blood pressure or hypertension. In this update, they emphasize the importance of recognizing and treating blood pressure aggressively. One of the most important changes has been the way we look at hypertension. Traditionally, if your blood pressure was consistently more than 140/90, you were deemed with a diagnosis of hypertension. But according to the new recommendation, if your blood pressure is more than 130/80, means you have hypertension. This means that many millions of people who previously thought that their blood pressure is borderline or even normal may now actually be called hypertensive. This is very important to understand as we have learned from multiple studies that some of the complications start even when you think your blood pressure is actually borderline.
Now most people must be wondering, what can they do with all this information? Should they get their medicine changed or something else? Well, here are a few tips that you can use in your daily life to have a better control on hypertension. Adopting the following changes can help decrease your blood pressure. Weight loss is an essential part in the treatment of hypertension. With every 1 kg of weight loss, blood pressure decreases by 1 mm mercury. Try and reduce the salt intake to a minimum of 1500 milligrams a day, and if possible, bring it down to 1 gram a day. Try and keep your diet rich in fruits, vegetables and whole grains with less amount of saturated fats. Aim to exercise for at least 150 minutes per week. Try and limit the caffeine intake in the form of simple coffee, tea and even soft drinks.
So basically, to summarize it all, get your blood pressure checked regularly. If you think your blood pressure is normal, definitely get it checked. And if you do have high blood pressure, please take it very seriously.
By adopting changes to your diet and lifestyle, you can have a better control on your hypertension. In fact, you might be able to decrease your medicines or even get off them completely.
Exactly. A healthy life and a good diet go a long way. That's all for now. See you next week.